Basically, people start trusting the same sign language interpreter, the same doctor. If they stick to the same person, if it's always the same person, they start building trust in that person. And this is very important to link to teleassistance. If we offer teleassistance through the Red Cross Foundation, we should take into account that element. We should use a reference person for teleassistance to help these people and these elderly people as well. And as for their relationship with the neighbors, it is very difficult for them to relate to the neighbors unless it is people who have been living there for a long time. They know them, they trust them. But when it is about new neighbors, it is very difficult for them to relate to new neighbors because of communication issues and lack of understanding. So these elderly deaf people usually do not leave their keys to their neighbors. It is not common to have someone getting in their home if they are not there. Also, in this study, we are constantly asking for video porter in the buildings, an intercom in their buildings, especially at the entrance, because deaf people from Zaragoza, Madrid, Valencia, they were constantly talking about the importance of this video or this intercom. It is very important. We talk about the RAMs and the access to homes, and this is very important. But the video intercom here in Spain is a technological element which is essential for deaf people, and we are lacking video intercoms. There's not too many homes with this device, and this is also linked to trust and robbery issues, etc. Communication codes that are used for teleassistance in the case of elderly deaf people. What could we use? Well, just pushing a button through a device hanged as a necklace, as a neck, or for example, call through a button, or for example, red and green button to confirm or to cancel a warning, or also a warning to see if the teleassistance call has been registered, and this could be done through a vibrating system or through a flashing system. Something important is also sign language in video conference systems, as we said before, or also in the case of those people who do not know sign language, well, we could use elements such as simple sentences or phrases or icons so that we can have these communication with the telesystem center. As for the placement of lights in the home, we carried out a selection. Well, we had a map of a home with the different parts, the different rooms in a home, and there were two main areas to use these warning system devices, both vibrating devices and LED or light devices. Basically, it's the sleeping room, the bedroom, and also the dining room, the living room. And there's two factors that should be taken into account. In the bathroom and in the kitchen, that's where more accidents take place. And it is important to underline how important these rooms are. But when we were studying this issue, especially with deaf people, elderly deaf people, there is this inequality. There is this issue of gender. There are gender issues. When we did these dynamics in groups, so we had 50-50, both men and women. But we realized that men were participating more. They were expressing more their opinion, more than women. And thus, gender does play a role. And when we had to choose the rooms, women were choosing basically bathroom and kitchen, and not that much the bedroom or the living room, and that's basically an education matter. And also in these dynamics, in these groups, when we were asking if one of the two members of the couple got ill, well, if the man was ill, it was the wife who was taking care of him, and she was in charge of cooking and everything. But when we asked what goes on when it's the woman who gets ill, the wife who gets ill, well, then the man was saying that he was going to the bar, he was getting the food ready there, and that was it. And he was not taking care of her. It was the son or the daughter who were taking care of the mother of the woman. So these are gender issues, and they are important to take into account in teleassistance. And now, to wrap up, in conclusion, and also linked to this study that we carried out, in teleassistance, there is a large heterogeneity of elderly deaf people. And here I would like to mention something important linked to what Miguel Ángel mentioned this morning. He was talking about flexibility and accessible. He was talking about accessibility. The home should be safe, should be easy to use. And he was talking about the respect to the identity of the different people. We're talking about elderly deaf people who are highly heterogeneous. We're talking about deaf people who are using the sign language. They know how to read and write well. Some others have different levels of reading and writing. Sometimes there's people who do not know sign language. They only know the oral language. There are some people who use both languages and also have a high level of reading and writing. So there are different levels of elderly deaf users that we have found in these 4 provinces that we studied. We have also seen some cases of deaf people who were not using oral language. They were not using the sign language. They have their own language. It is very difficult to communicate and interact with them. And the reading and writing level is also very low, so specific attention should be devoted to these people. Thus, we should apply different models of accessibility of teleassistance depending on the profile of the different elderly deaf people. There's also different action protocols of teleassistance that should be implemented according to the different profiles. It is important to generate trust, to build trust, and to involve everyone surrounding the deaf person, neighbors, family relatives, also helping them technologically and economically so that these services can be adapted to these users. And the final objective is to improve their quality of life and the autonomy of these people. Thank you very much. Thank you very much, Leandro. Now Begoña will tell us about the analysis of the attention protocols that the Red Cross has right now and how they should be implemented to help this group of people.
Buenos días a...
Good morning to one and all, and I would like to thank the organizers. I would especially like to thank my colleagues Juliana and Ana from the Texo Foundation, because I am here before you today to talk about our joint project thanks to them. And I would also like to thank all of the entities that have helped us in this project, the FENSE Foundation, the Vodafone Foundation, the Polytechnical University, and the Texas Foundation, because throughout these months, while we have been developing this project, we are learning a lot as a service provider. We haven't finished the project yet, but the balance is already quite positive, and I would like to thank publicly all of these entities. The Red Cross is a humanitarian foundation, and we use the willingness of humanity and volunteers to try and help people who have social needs and special lackings. Our mission, vision, and our principles make us be a pioneer entity in teleassistance services, among other services that we offer. And after years of collaboration with the Vodafone Foundation, in June 2002, we decided jointly to create a foundation that takes into account both objectives, being close to people and trying to offer solutions for people with social and other lackings through the technologies, which was the knowledge and the contribution of the Vodafone Foundation. And we created the Texas Foundations like this. And next to this foundation and other entities and other partners, we have been working together for quite a long time, incorporating new technologies to try and help these groups. Teleassistance started in 1999, but until until the year 2009, all of those entities that I mentioned at the beginning, well, that was the year where we were trying to offer some solutions for these deaf people, because the Red Cross is offering many services, but we were excluding this specific group, and that represents 1 million people here in Spain. Let's talk about teleassistance and what teleassistance is to understand it, the basis of our work. You know that the home teleassistance is that device that elderly people have. Well, it's a platform similar to what you see here, with this remote button that can be a necklace, or it can be a key ring or whatever. It is within the home, and if someone falls, as you can see here in the slide, the user has the option to press this button, this remote control device that he should be carrying around in his home. This issues a sign so that the telephone or whatever platform he has in his home sends an alert, a warning to our center, as you have just heard. And over there is an operator who gets this call, and immediately this worker has all of the data of the home, the family, the relatives of this person, so as to handle the emergency call in the most suitable way. And this does not necessarily involve health services. It could also be calling a neighbor or a family relative of that specific person. And finally, we will solve the emergency. So these are the basic elements of teleassistance. This is the hardcore that we have been focusing on in our project. Teleassistance throughout many years has been incorporating other services, always focused on improving the quality of life of the dweller in his home, and always trying to make this dweller as autonomous as possible in his home, because we understand that if they stay at home, they will worsen in a more slowly pace. So the research group was giving us a lot of data on the real needs that the community had in Spain. And the first thing we did was to search among our documents about our information. Why don't we have teleassistance for deaf people? So the general regulation of the FEM foundations for the last few years, well, they have some criteria. And here I just mentioned a few. For example, elderly people, disabled, who live on their own, or who live mostly in their own, or where they are at a risk situation, both dwellers, for example, or for example, people with mental diseases such as dementias are excluded. And we should also exclude those people who have auditory or oral expression difficulties. So people who are at who were deaf were excluded based on these criteria. But more recently, in 2007, we had some new regulations.